suicide is just the most awful thing. I mean, my uncle, a GP, at the age of 60, developed the idea that he was worthless, and he hung himself. And nobody knew this was going to happen. And then we went through his desk and we found there were all these calculations about what he was making from the practice, the cost of the practice, the car, the lack of superannuation and so forth. He would write broke in big letters at the bottom of everything. He had a reasonable superannuation policy. He had 4 reasonably wealthy kids. He had no reason to do this at all. I mean, he'd become mildly depressed and he'd become obsessed about his financial situation. He'd killed himself. And in fact, nobody had even talked to him about this. And it's just awful that this is 25 years ago, that he wasn't able, he didn't even discuss it with his wife. Many cases of suicide, they don't come to the attention of psychiatrists, GPs, mental health practitioners. About a third of them just go out and do it. And in fact now 3 times as many people suicide as are killed in car crashes. Now that wasn't so. Like when I started out in medicine 50 years ago, car crashes were a major killer of men. Like there were 3,000 car deaths a year in Australia. And now there's about 3,000 suicides and 1,000 car deaths. And we got rid of the car deaths because we brought in seat belts, we brought in alcohol testing, we brought in better engineering of cars, better engineering of roads. We've made a huge difference. But we haven't been able to do that with suicide, fundamentally because it's hard to tell when it's going to happen. Like with the car crash, there were all these things you could see when you investigated. So with suicide, in suicidology, we're trying to look back and find the indicators, particularly in young people, and deal with them. And again, things like the origin and mental health and getting into preventative stuff with young people so they stay connected, they look after one another, they ask, are you okay? And if the answer's, well, not sure, don't know, maybe not, then getting some help.